Okay, I'm gelling in. Hi, my name is Sophia. I'm going to be your nurse today. We're going to be doing a full head-to-toe assessment on you. I've checked the room. It's all safe. Nothing needs to be done, and no visitors are present. Can I get your name and date of birth for me?
Caitlin Garden, September 20th, 1998.
Okay, can I check your armband? Okay, and this is indeed Caitlin Garden, birthday September 20th, 1998. And I checked her medical record number against the medical record, and they do match up. Okay, I've already assessed with Caitlin that her airway is open and her breathing is unlabored. When I touched her armband, I noted that her skin was dry, pink to tan, and warm. Okay, Caitlin, do you have any allergies or to medication or food or anything like that?
No.
Okay, and then I also take your vital signs, but first I'm gonna ask you a few questions. Do you know where you are today?
In a hospital.
Okay, and what month is it?
November.
And what holiday do we just have?
Thanksgiving.
Oh, awesome. Thank you, Caitlin. Before we take vital signs, just to note, Caitlin has no tubing present, no Foley catheter, no IVs going. She's on room air, so no oxygen. All right, so we're going to do your vital signs, Caitlin. So I'm going to take your blood pressure, heart rate, temperature, and oxygen. So your heart rate is 75. Your blood pressure is 118/78. Your respirations are 16 and your oxygen's at 100. And I've looked back at your previous vital signs and those are around the same range, and that's within normal range for a 22-year-old healthy female. Okay, so now we're going to start your assessment. So I've looked at Caitlin and I've seen that her base is symmetrical, and so now I'm going to check your mouth. Okay, so if you can just open up for me. And her mouth is pink and moist, no dentures present, and her teeth are intact. Okay, thank you. So now I'm going to check your eyes. So I'm just going to shine a light in your eye. I just want you to look at this for me, okay? All right. So her pupil dilated to 3 millimeters. I'm going to check her that her other pupil dilates as well. So I'm going to shine this back in your eye, okay? All right, her other pupil dilated. So now I want you to follow this with your eyes. Just and forth and up and down. Okay, her eyes were equal. And then I'm gonna put it in and you just like follow it. And then we're gonna go out. And then her pupil is dilated as well. So Perla is intact. Okay, so now we're going to move down to your chest. Caitlin, do you have any breathing problems or chest pain?
No.
No breathing problems? Okay, and her chest is symmetrical and when it expands. So I'm just gonna listen to your lungs, okay? So we're gonna start with your lungs first. So every time I move the stethoscope, I want you to take a deep breath in a new area, okay? And for the sake of this video, we're not gonna lift up her shirt for privacy, but we would do skin to skin in a real assessment, okay? But we can get here, so. Deep breath for me. Okay, now can I get you to roll on your side so I can listen to your back? Okay. Oh, you can roll back over. All right, everything sounded clear, no ronchi, no crackles, nothing like that. Her breath sounds weren't diminished, they were very clear. All right, so now I'm gonna check your heart rate. So I'm just gonna listen to your heart. I'm gonna start up here and then I'm gonna check for your murmurs, okay? Okay. So we're gonna start here. We go to the second intercostal space, so right here. And you could just breathe normal. Here. Okay, so S1 and S2 sounds were noted, no murmurs or anything like that. So now we're going to be moving down to your abdomen. So tell me, do you have any problems voiding?
No.
And when was your last bowel movement?
This morning.
Okay, any nausea or vomiting?
No.
And how's your appetite been?
Good.
It's good? Okay, so I'm going to listen to your tummy now. Is it okay if I pull up your shirt for your tummy? Okay, so we're going to listen to all 4 quadrants and we'll see. We're starting the right. So we heard normal bowel sounds in all 4 quadrants. So now I'm just going to palpate your tummy. Is that okay?
Yes.
So we've noted that it's flat in contour, non-distended. And then we're going to just... Do you feel any tenderness or anything like that?
No.
Okay, so no tenderness, and her abdomen is soft. All right, so now we are going to move on to your upper extremities. So first, I'm just gonna look at your arms. We said before they're warm, dry. I don't see any lesions or anything like that. No swelling. The color is normal. Do you have any numbness or tingling?
No.
And then any weakness in either of your arms?
No.
Okay, awesome. So I'm gonna check your pulses. Your radial pulse, okay. And then 2+ bilaterally. All right, so now we're gonna test, can you lift up your arms? Okay, so she's got motion in your arms. And then I want you to hold my hands and then push against them. And now pull. Okay, awesome. So strength is normal bilaterally. And then I'm gonna check your capillary refill. So we just squeeze this right here and then it comes back. And our capillary refill is less than 3 seconds, so that's good. So we're gonna move on to your lower extremities now. Can I pull your pants up?
Yeah.
Okay, so we're just gonna expose to the thigh. Okay, same thing. No lesions noted. Color's good, warm and dry. Skin's intact, no swelling. Do you have any numbness or tingling in your legs?
No.
And then, do you have any strength issues in your legs either? Okay, so we're gonna kind of do the same thing. We're gonna have you push up with your feet, okay? All right, and then push down. Okay, good. Strength's equal bilaterally. Now I'm gonna check your pedal pulses. Okay. It's good. Okay, 2+ bilaterally. Alrighty, now we are going to move on to just your overall skin. So I'm gonna check your turgor real quick. So I'm just gonna pinch this little area of your arm, and it went right back down, so no tenting, which means you're well hydrated. And then, so I'm gonna check, we haven't seen any lesions, but I'm gonna check your pressure points where they're most commonly found. So if you could lay on your back for me, or on your side. Yeah, I just need to see your back. So I'm checking your back, no redness, nothing like that. I would check her sacrum and her buttocks, but we're not gonna do that for the sake of this video, but all clear, no redness. Checking her pressure point, so between her knees, no redness. Then I'm just gonna check your heels, okay? And then, no redness, everything's warm and good. You can roll back over for me. And so, tell me, how has your care been in the hospital? Do you have any complaints or anything?
No, it's
Nothing?
been good.
Okay. All right, Keelan, well, I'm all done. I'm gonna perform hand hygiene, and then I'm gonna go. But thank you.